I'm here in downtown Phoenix, where temperatures are already approaching the mid-90s and expected to rise later on today. Doctors warning that with hot temperatures so early in the morning, it makes it that much more difficult for people to fully physically recover from all of this extreme heat.
I have a patient in here and we'll just kind of dump ice all over them. So 4 or 5 of these buckets. The only thing shown would be your mouth.
Emergency room doctor Frank Lavecchio is using kid pools and body bags filled with ice to help save the growing number of patients he's seeing with heat stroke.
This is reserved for the sickest of the sick. I've worked a couple day shifts the last few days and probably used it 3 or 4 times.
He says his Phoenix hospital has had a recent spike in heat-related injuries.
Phoenix is used to heat waves. How unusual is this heat wave compared to previous ones?
This is record-breaking. We're breaking the wrong records.
Phoenix just broke a heat record set nearly 50 years ago, and Tuesday marked the 9th day in a row temperatures didn't drop below 90 at night.
There's not a lot of signs for this heat to break down, at least for the next 5 to 7 days for sure. We're looking at temperatures continuing well above normal.
Lavecchio says each heat stroke patient he treats needs at least 5 members of his ER staff.
Yesterday we had 3 in a row, so we really were tight on staff. You know, everything else in the emergency department kind of comes to a halt.
And with temperatures expected to stay at dangerously high levels.
This could carry on through the rest of the month. What are you preparing for here? What's the hospital preparing for in that scenario?
Unfortunately, more of the same. It is the worst that we've seen.
And officials say since early June, there have been nearly 700 emergency calls, all pertaining to this extreme heat. And here's something incredible. Paramedics arriving on the scene of some of these calls are in some cases using IV, ice cold IV, and injecting it into patients to save their lives. Nancy, Anne-Marie.
That is extreme. Jonathan, thank you very much. And let's bring in Travis Parsons now to talk about how this heat is impacting workers. He is the director of occupational safety and health for the Laborers Health and Safety Fund of North America. Travis, thank you for joining us. Tell us about the impact extreme heat is having on these workers. They have really no choice often but to work through it.
Yeah, good morning. Thanks for having me on today. Obviously, as the heat increases, the hazard of heat illness or heat-related illness goes up for these workers. And as the heat rises, we have production rates go down. Workers are less focused, more agitated. They don't listen to each other. They don't pay attention to the valuable training they've had. And the hazard just increases as we go.
What are the most dangerous jobs to do in this type of heat?
It might be somewhat obvious. Outdoor jobs like construction, landscaping, farm work, and also indoor jobs as well, where there's not protections like air conditioning and high heat hazards, but outdoor jobs especially.
Given that, what kind of protections is your team fighting for?
Oh, geez. And there's a tagline called water, rest, shade. It seems simple, but it's not required on a lot of jobs out there. The requirement of having proper hydration and water available, proper rest and proper shade to rest in. Other areas we're looking for is acclimation training for workers to get acclimated to the job in the heat, information, and also a very important one for us is a non-retaliation policy. And what I mean by that is for the opportunity for workers to speak up about heat without reprisal.
I think maybe earlier this year in Texas, the governor had rescinded, I don't know if it was a guideline or a law about outdoor workers sort of being allowed to have water and have breaks at a certain time or a certain period of time. When you heard about that, how concerned did that make you?
Oh, very concerned. It was in Austin and Dallas area, 2 parts of Texas where the heat wave was hitting hard. And what it was a broad brush getting rid of a lot of regulations at a local level. And one of those regulations was requirement for rest and getting water. And as a matter of fact, at least one, maybe 2 workers unfortunately passed away a week later after those rules. So yeah, we were very concerned. We're still very concerned about what's going on with the heat wave in Texas. And we do not like to see those broad brushes like that and getting rid of protections.
Expanding beyond that and looking nationally, what is the status right now of a possible national worker protection against these heat dangers on a larger scale?
Yeah, the federal OSHA is working on a standard. The problem with that is the standards process takes many, many years. An average OSHA standard takes 7 to 8 years. They're just getting out of what they call NACOSH, which is an advisory board. So we don't see a federal heat standard for years to come. One general consensus standard that we are involved in and we worked on is what's called ANSI A10 standards, which are voluntary consensus standards for the construction industry. We are balloting that standard as we speak. It's going to be a very comprehensive standard that should be out within the year.
Travis, I don't know. It seems like it's a no-brainer to have some sort of national standard, especially when it seems like year after year we're continuing to see these really hot temperatures. And if you talk to scientists, it's not going to go in the other direction anytime soon.
Only going to get worse.
Exactly. Travis, thank you very much.
All right, take care.